You're listening to Turn On to Tech with Jeff Levy and Bonnie Jane Bentley, right here on LA Talk Radio.
And welcome to the show. It's called Up on Medicine. My name's Jeff Levy. I'm the digital doctor of sorts. Also, I give lectures to groups of health professionals and doctors for education purposes. I've been around this business a long time, and I'm here with my two favorite people and partners, starting with you, young lady.
Bonnie Jane Bentley.
A consumerist.
A consumer and a caretaker.
Caretaker. Mm-hmm. And a lot of other interesting things.
A lot of other things.
Oh, yeah. And our resident doctor.
Hello, San Fernando Valley. This is Dr. Ronald Belzik, a reconstructive foot and ankle surgeon specializing in amputation prevention. You can find me at Sherman Oaks Hospital, which, as you know, is part of the Prime Healthcare
Group. Yep. Yeah. And our guest in studio today is Dr. Dreyer. We will get with you in just a moment, Doctor, and introduce you properly. A little bit about the show. It's your window on the world of medicine because we talk to the doctors, the caregivers, the providers, the inventors, the tech people, and we bring it all to you and we sort out the wheat from the chaff.
You bet.
Too much chaff last week.
Yeah, you bet.
Oh, my gosh. You can call us during the week with your questions. We have a brand new phone number, area code 844. It's a real simple number, 339-5333. You know why I love that number?
Why?
Because 5333 spells Jeff on the phone pad.
It does.
Oh, yeah. So I can remember it. I only have to remember a couple of digits. Or you can write to us at uponmedicine@yahoo. Just a minute about the show. This is actually a radio show that we're doing on video. So you'll see us look at the camera, we'll look at each other, we'll look at some notes, but this is how we do it. So you have kind of an inside eyeball on a radio show. And once we've done it, you can hear it on YouTube. Or you can go to latalkradio.com, the video channel, watch it, you do all that. I think I'm done. I think it's your turn. You have a segment we start the show with called In the News.
In the News.
In the News.
Now, my first thing is that Anna Storr wanted to join Facebook, but she couldn't.
What?
Because you have to be 13 to 99 years old.
Oh.
And so she lied about her age, and she logged in as 99.
And how old is she?
Well, she wanted to post her photos of her 114th birthday party.
Oh. That could be an issue, yeah.
Granny Go-Go, yeah.
Good for her.
Okay. Now, Apple and Facebook are going to pay for women to freeze their eggs.
Really?
All their women employees, which is terrific.
It's
because
expensive.
So many women are afraid of moving forward with their careers and not stopping to have children. So this is great. They'll pay up to $20,000 for non-medical reasons, and they will, that would cover the cost of the harvesting, as well as $500 a month for a year for a long time for storage.
Keep them. Mm-hmm. Doc, what do you think?
I think that's definitely a way to recruit women in the workforce.
I think it's magnanimous.
Which is what they're trying to do, because 70% of Apple's workforce is male, and 69% of Facebook's workforce is male. They want more females.
Well, that's one way to do it.
I'm just wondering how effective that would be in terms of freezing the eggs, what the survival rate would be.
Well, we've been through that with my daughter, Victoria.
Yes.
And they freeze a lot of eggs just for that reason, Doc.
And a lot of the times the women go for two different harvestings, so they have two different crops to choose from. But the thing is, you're much better off if you're going in your 40s to have a child, to have a 30-year-old egg, one from when you were in your 30s.
Good point.
Or late 20s, than in your 40s.
Good point.
And they're having great luck with it, so.
Fantastic.
Yeah.
What's next?
3 cups of coffee per day
equals
yes. Okay, equals healthier levels of liver enzymes. And this includes decaf. So it's not the caffeine.
Oh, because I don't like
So you don't have to
decaf.
be
I drink
up all
John
the-
Wayne coffee.
Yeah, but you don't
Forget
have to be
that.
up if you can drink it at night and get your liver enzymes up.
Okay, but I'm not going there. Okay.
Okay, women can cut their stroke risk in half with using 5 things: healthy diet, moderate alcohol, no smoking, physical activity, and a BMI less than 25. Which
Body
that-
mass index.
Body mass index,
Yeah.
yes. That would mean a woman of 5'4" would be about 146 pounds. So, and be on a low dose of hormones. And,
Yeah, those hormones.
and
we're
know
gonna
your
get
signs of stroke.
fast.
Fast.
Face.
Face, arms, if you hold up your,
Right.
one of your arms is drooping. Okay. And,
What are the others?
slurred speech or
Yeah.
slow speech.
Right.
And time. Get yourself to the doctor or
On
the
time.
hospital right away.
All good. Okay.
Airplane cabin cleaners on strike at LaGuardia Airport. During that time, they found out from the air service workers that they had cut their cleaning time from about 45 minutes to about 5 minutes. Huh? Can you believe that?
How can they do that?
It's not so good. Okay.
Okay.
Okay. Gallup study shows that 3 close friends at work equals less stress. You'll be happier with fewer accidents. 83% more satisfied at work, and more ideas and
More
creativity.
creative. If you have at least 3 people, you can call a
Yeah.
friend. Well, I have 1,
Hi.
2.
Well, Tyler.
Dr.
and
Dreyer, nice to
Sam,
meet
and
you.
everyone. You got a lot.
There you
Okay.
go.
Okay, Orkin says that the #1 city for rats is Chicago. But based
What
on the
kind of
number
rats are you talking
rat
about?
treatments done each year by Orkin.
Oh, the pest control.
Yeah, so you have to have the money to do Orkin in the first place. And so that means that the people that don't have the money, like in the tenements in New
Yeah.
York, they're not
In
using
Chicago. They
Orkin.
must have a lot of deserting ships. That's where all the rats went. Moving right along.
Okay. Covered California notified 100,000 people that they needed to provide proof of legal status in order to qualify for their benefits. Well,
Oh,
about 10,500 did not return the form. They either forgot or they're
they're not legal. Mostly they didn't forget.
Well, yeah, but some of them,
Yeah,
people
maybe.
don't open their mail.
I
They're going to
noticed
be
that.
real upset when their benefits stop.
Oh, that's not good. All right.
And the last one is Paula Abdul is Avon's ambassador for the fight against breast cancer. And she's brought out this really neat new video on YouTube called Check Yourself. And it's really catchy, and her sister Wendy, who's a breast cancer survivor, is in it with her, which is really nice.
All right. Very good. Moving on. Google Hangout is something that Google has, and doctors, you're going to love this, maybe not. Looking at the internet for medical information, there's a wealth. It's almost overkill. Hundreds of thousands of pages of medical information. But what good does that do you if you look something up and you don't know what to do about it? So Google has a new service that's based on your search. Whatever you search for, it will suggest connecting you to a live physician who has been vetted, licensed, and so on, and you can ask questions about your inquiry.
Who pays for that?
Google's paying for it in the initial trial phase.
Nice.
Yeah, what do you think?
Well, can't hurt.
Well, in order to become a health provider that's part of this, you need to show that you are currently licensed and that you're covered by HIPAA. And it's a couple of little things. Dr. B, what do you think? Can you see giving advice to people? I'm certain, no, you don't want to do that.
Well, you know what?
You don't have time to do that.
It's very interesting because people who in need sometimes want a quick answer, a quick fix. And so this may provide some guidance, but without being able to have the tools to further investigate, it may be purely academic, the type of advice that I can give. They may need further workup and follow-up at a clinic or hospital.
Very good. I'd
But
like to hear what.
at least by a doctor saying so, go to your doctor and have him talk to him about this and that. Then
That's
at
a
least
big
they have-
problem medically with the internet is people are trusting the internet more than they want to trust a medical professional. That's crazy. What do you think, Dr. Dreyer?
Well, in the patients that I see, when patients go through the internet and try to search out answers, they usually get very confused. And so if a doctor can point them in the right direction,
Good point.
that might
You
be
and Dr. Belzik nailed it.
that might be useful. But in the long run, that's just a short fix. I think they have to be pushed in the right direction or turned in the right direction to seek the appropriate help.
Well, I think it is a short-term solution.
But it is a turn in the right direction.
It
because
is,
you can
absolutely.
say, go see this type of doctor or that type of doctor.
Right.
And that way they know
Or,
where to go.
for instance, the doctor can say, well, this kind of information that you're looking up is not very useful. Maybe you should look elsewhere.
There you go.
And that would be
Mm-hmm.
helpful.
Dr. Belzik, I could see your handsome face on Google Hangouts. And Bonnie and I'll come hang out with you.
Oh, I'm sure we could do a lot of good.
You know, Bonnie, I shop at Trader Joe's. I'm not bashful about that.
Yes.
And they often have food samples of dishes they make.
Uh-oh.
And I often say, do you make house calls? And that reminded me of the segment you're going to do right now.
Oh, no. We're going to talk to our doctor first.
Want to do that first? Okay.
Absolutely.
Doctor, why don't you introduce him? Have you got that information?
Okay. Dr. Gerald Dreyer. Okay, you specialize in internal medicine and infectious disease.
Yes, I do.
Okay, and you went to medical school. Now, where is Albert Einstein College of Medicine?
You're not familiar with it?
Not yet.
Not
Okay.
yet.
It's in the yeshiva, I'll bet.
It's Albert Einstein is located in the Bronx. It's a major academic institution. There are about 7 academic institutions in New York State itself, and Einstein is one of the best. It's affiliated with Montefiore Hospital Medical Center. It's essentially, it trains in all different disciplines. And that's where I went to medical school. I did my internship and residency at Montefiore Hospital Medical Center, also in the Bronx. And then came out to UCLA to do a fellowship at the UCLA San Fernando Valley program.
Ah, right here.
Right, and I did my fellowship and then ran the house staff training program at the same institution for the next 5 years before going into practice.
Outstanding.
Terrific.
Well credentialed. Dr. Belzik, later in the show, I know you've had fellows in your practice. I want to find out a little bit more of what that program's all about. But we've asked you to join us today, Dr. Dreyer, because your specialty is infectious diseases, and you can't turn on the radio or television or pick up a newspaper without hearing the 5-letter word Ebola. That's all they talk about now. It's very scary.
Very true.
It's interesting that some people in the country want to curtail flights out of Africa and say, you can't land here. All the cases of Ebola in America are from Texas, so we shouldn't let any planes from Texas land here either. Hello. Genius.
Yeah, but they came from Africa.
Well,
Come on.
no, the people in Texas didn't.
Okay.
Okay, so doctor, briefly, Ebola, what is it a virus? What is
Well, Ebola, of course, is a virus. It's a hemorrhagic virus. It was
it? Meaning hemorrhage.
meaning hemorrhage, meaning that people bleed when they have this disease. It's affiliated with other viruses, which you may or may not have heard of, Marburg virus, a number of different hemorrhagic viruses. Dengue, for instance, is a hemorrhagic virus, which you may have heard of. The first outbreak of Ebola virus was in 1976, and there have been about 27 outbreaks since that time, almost all in Africa, in Western Africa.
Western Africa.
Right.
Yeah.
This is the biggest outbreak that they've had, and I think that there are at least 3,500 or 4,000 people involved in Western Africa, which is more than any of the other outbreaks combined. So this is the largest outbreak.
How's the survival rate?
The survival rate, it depends on the studies, but usually the survival rate, once you get the disease, is between, the fatality rate is between 70 and 90%.
Ooh.
So it's not
Well,
a
of
good
course,
thing.
especially in Africa, maybe someone here in this country that's now getting transfusions or getting special drugs. They've got
Well, we don't have any special drugs per se. I mean, there are some vaccines that are being tried, experimental, that haven't really
And
come to fruition.
transfusions from people who have had Ebola and survived it.
Right.
How does that work?
Well, you're looking for antibodies that may help to fight the antigen itself and to curtail the disease. But the major advantage of treating in the United States, of course, is that you have up-to-date facilities. You have state-of-the-art situations in which you have appropriate IV therapy. You have appropriate intubation if necessary. You have pulmonologists, you have cardiologists, you have vascular surgeons, all available.
And you have isolation.
And you have, well, you have excellent isolation. That's mostly for the help. That's mostly for the nurses and the doctors who are aiding in the care of these poor souls. But getting back to a political issue, I think that it's probably a reasonable idea to curtail flights from Western Africa to the United States, even though it's not difficult to circumvent that by going to
Other countries?
other countries and then flying in
Yes,
that
you could
way.
fly from from London right to Los Angeles, and they're not really screening people
But what
too
about
much at
what about
LAX.
people who want to go there and work and help? They can't come back.
Well, they'd have to have they
Well,
would have
couldn't
to
they
have
get tested?
a quarantine period
Yeah.
during which
Maybe that's the way to do
during
it.
which they could not come back, and the incubation period is between 2 and 21 days, as everybody by now knows. In addition, there are tests that can be done to see if you have the antigen to Ebola. There's an ELISA test that's available.
We talk. I think
We
we
did
talked
talk
about
about
that
that
last
last
week. You
week.
get the results in about an hour.
You
Yeah, it's too
can.
bad I mean, if it's cost effective to give everyone coming into the country.
Well, that's another
that,
story.
That wouldn't be cost effective.
No,
Dr.
I don't
Belzic?
think so. Well,
Dr. B, do you ever worry about people coming into your clinic that carry these not maybe Ebola, but influenza and all these other things?
We do, and in fact, we with every patient try to take necessary contact precautions, but sometimes these things are transmitted other than contact, and their symptoms may not be so transparent. They may just have a headache or a fever, and when I'm looking at a foot infection, usually that's some of the symptoms that they may have. So very similar symptoms in the earlier stages of this particular infection.
Well, getting back to Ebola, how is it actually transmitted, Doctor?
Well, as opposed to influenza, which we
We'll
can
talk
get
about.
into in a little while, Ebola, you need direct contact with fluids, secretions, so that it's not something at this point in time, at least, that's airborne. And
so
that's-
they can't cough and you can't get it from
that's
that.
very important, that you can't get it from the cough itself. Now, that could be iffy too, because if you have another disease and you have, for instance, if you have influenza along with Ebola, and you cough and you have secretions with Ebola
And you
in
spit
your
them out.
system,
Oh,
and you spit that out, then certainly that would be a risk factor. But you also have blood contamination, fecal contamination, and
urine
urine,
and sperm.
and sperm. And that's really, in terms of the fecal and urine contamination and so on, that's how it's mostly spread in West Africa. And that's why it's so deadly, whereas here, where you can have isolation techniques, the spread itself is not as great. In addition, the virus itself can live on countertops for a number of hours. And so that's where the issue of the planes come in, where someone gets into a plane, contaminates it, and then leaves the plane. And as was the case this week, that plane can fly to 5 or 6 different places with a number
lot
of different
passengers.
passengers, and then you're in a situation where, well, do we quarantine everybody for 2 to 21 days, or do we just wait and see what happens?
Imagine what happens when somebody's on a cruise ship and you've got 500 passengers.
Well, they did have someone on a
I
cruise ship,
know.
and they wouldn't let her off in Belize because the government said, Belize
Nope,
said,
they don't want
absolutely
her.
not. We're not letting you come ashore.
What happens? I got a question. What happens to the remains? So let's say they incinerate the person and they have the ashes. Is the virus still exist? Is that a concern of where to dispose of the ashes? I mean,
That's a great question.
I'm not sure.
I think we'll make it our Tyler's assignment to find out.
They're putting Tyler to work.
Putting Tyler to work. All right, Doc, moving on to influenza. You know the old joke about the guy who skipped work and the boss said, "What happened to you?" And he said, "I got sick. I opened the door and influenza." But it's not funny. What is influenza?
Well, influenza, again, is a virus. It's an RNA virus. And we've had influenza around for a very, very long time. In fact, we had a terrible epidemic of influenza in 1918, in which a large part of the population of the world was affected, and with millions and millions of deaths at that time. And subsequently, people developed encephalitis related to that particular influenza epidemic. At any rate, influenza is a pandemic. It travels all over the world. It usually starts in China and then comes all the way around.
Like the
Makes
bird
its-
flu or whatever.
Like the bird
There you
flu
go.
and so on.
Good point.
We usually contract the influenza virus around October, and it stays until March, April, May.
So people should be getting their flu shots if they haven't gotten them already.
People should be getting their flu shots right away, as of now.
What are some of the symptoms of influenza?
Well, the symptoms, again, are general malaise,
I have that anyway.
just a feeling of not feeling well, fatigue, and then of course cough, low-grade fever, headaches. These are the typical symptoms and signs of influenza, and it's very important that this is recognized so that it's not spread from person to person, because that's how pandemics occur, that's how epidemics occur. We had 25 to 30,000 deaths last year in the United States, and well over 60,000 deaths worldwide. And of course, we don't have good statistics in the third world countries.
When does it become contagious?
Yeah, how is it transmitted? Good point.
Well, it's transmitted by cough, and
Oh.
it's
Airborne.
transmitted airborne, which is why it's so much more transmittable than something like Ebola, thank God. But there is a significant morbidity and mortality, and therefore the recommendations are to start vaccinating from the age of 6 months. And so if you have a 6-month-old, that's the time to start. There are different kinds of vaccines. Each vaccine, for instance, this year, we have the same serotype as last year, which was H1N1, and it's usually combined with other serotypes. So, for instance, you're going to have H3N2 along with H1N1, and that's the typical trivalent vaccine that people are getting now.
So the thing is, if you're just feeling kind of tired, you're probably going to go to work or go to school because you just think you're kind of tired, and malaise, whatever.
Right.
So when is that? Are you contagious already at that point?
When you start coughing, then you're contagious.
Okay.
When you start coughing.
So, in Dr. Belzic's case, you see a lot of patients that come from goodness knows where. At what point might you be concerned that somebody might have influenza? You obviously look for coughing and sweating, and
right, yeah. So
He usually gives me a call.
there you go,
Yeah.
bingo.
It's easy.
But just to get the point, your staff will look for symptoms like that.
They will check the vitals every time.
Blood pressure, heart
blood
rate,
pressure,
And
temperature.
temperature.
Yeah, very interesting.
Okay.
What's the treatment protocol for influenza?
Well, again, if there's no vaccination, first of all, vaccination is number one. And there's a lot of myths that we can talk about with regard to vaccination, but there are some drugs that are effective once someone does come down with influenza, including Tamiflu. And Tamiflu at 200 milligrams twice a day for 5 to 7 days is usually quite effective. There are a number of
Outstanding.
different oral agents that are effective.
Antibiotics?
No, they're antivirals.
Okay, so it
But
would
you
not
have
be.
to get them fairly quickly, right, at the onset of
Within
symptoms?
within 48 hours.
Yeah, so a lot of people might say, oh, well, I've just got something, I'll be better in a couple of days, and then it's too late to take the Tamiflu?
That's right.
Oh,
Nice.
And in addition, people who develop the flu who also have lung problems may develop secondary infections with staph or pneumococcus and become even more ill. So
Not good.
people with lung disease have to be really
so
careful about.
what should we do to avoid getting all this?
Live in a bubble.
Yeah, and take our flu shots.
Exactly.
Okay. We'd
but-
like to have you come back another time and talk to us about vaccines. You had more questions.
Oh, no, I was just going to ask, any ideas as far as how to protect yourself in public? Public
With-
situations, venues, if you're going to a concert?
I think it's very difficult if you live in Japan, you can wear a mask, but ordinarily people don't walk around with masks, and they don't walk
No.
around
Not yet.
with protective
Not
cover.
yet.
Not
That's
yet.
right,
That's
yeah.
the operative
so,
word.
So, they are very careful.
It's like I'm
In-
taking my nitrile gloves to the supermarket
Right.
to
In,
put on the
in
basket
certain areas,
now.
in certain areas of the world, people are very careful about not contaminating others or being contaminated. But
Not
in
here.
the United States, it's not the
Not
case,
here.
and so you're going to be spreading
Right.
disease whether you like it or not.
I was at Bevmo the other day, and I was number 4 in line, and the first person in line was coughing, and I walked out. I covered my mouth and I left, and I came back later. It just really upset me.
Yeah,
So-
that they're not, especially.
I mean,
And whenever you're in an airplane, someone starts to cough, and then there's coughing all around. So.
yeah, and you have nowhere to hide. Doctor, how do people find you?
Well,
You can give your office phone number if you'd like
okay,
to.
I'm on the internet, but my
Well,
office phone
we'll
number
do that
is
too.
818-784-3615. My office is in Sherman Oaks,
And you have a website,
and I have a website.
which is?
It's infectiousdiseasesdoc.net.
Nice.
Great.
All right. Hey, Dr. Belzik, how about that? That's a good one. You could stay with us for the rest of the show if you have time.
I'll stay for a few minutes.
Okay,
but I'm
let
gonna
us
have
know
to
when
leave
you
soon.
have to go. We really appreciate your input.
Sure.
Spoken like a doctor.
Yes.
Todd Moldauer said to say hello to you.
Oh, thank you.
You know Todd.
Of course.
Yeah, he's a good friend of ours. Okay, concierge doctors. I can't wait to hear this one.
Well, Real Money on ABC on World News showed people how to save money. I mean, that's what they do. So on 1013, they did a story on concierge doctors. Now, what is a concierge doctor?
So a concierge doctor is a physician that will treat you at your home or work.
House calls? Really?
House calls. So that is what their specialty is. So they may be able to come in, take care of you, your family on a regular basis. There's about 10,000 of these physicians in the United States.
Concierge.
Huh.
So they don't need the office overhead.
That's correct. So there are some advantages, right? So that they can visit you based on your schedule, your availability. So there are some benefits with that. But then again, they don't have the staff and the support they may need.
So that's
in all
an
situations.
advantage to them in some ways because they don't have to support that staff
That's correct.
as a doctor.
On the other hand, they have to do everything
They
themselves.
have to travel, they have
have
to
to
go
travel.
everywhere, and if they're not available at the time you need them,
I imagine that would work very well in rural parts of the country.
I think it works much better in in areas which have a lot of wealth and where people are willing to spend the money.
That's another thing doctors are doing these days.
Yeah, I think that the whole thrust of the concierge movement is to get paid, whereas Medicare, Medi-Cal, and so on keep cutting back on the wages of the doctors. Okay, and so the doctor's doesn't have control over his own practice. And so what the concierge doctors do is they make contracts with their patients so that the patient pays a certain amount per year. And then the concierge doctor can accept Medicare or what have you as well, but has this amount of money that he's definitely going to get from his group of patients.
Kind
So
of
it's
like
almost
in
like
China.
prepaid medical.
Well, in China, they used to have, or I don't know if they still have, the system where someone can pay the doctor monthly as long as they're well.
There you go. That's
Yeah.
insurance in a
And though
very...
he doesn't get it paid if you're sick.
Dr.
so.
Belzik, you're actually doing something like that
Well, we're
with
available,
iPads.
Right, we're available 24/7. We do use iPads. We have a number of them at various nursing homes, and they will call us whenever
That's
there's any questions. So
nice.
there may be a new patient or existing patient. They don't know how to triage, this particular patient. They'll call us. So
Well, what
that's
happens,
great.
Bonnie, is that these care homes have iPads.
Mm-hmm.
And so using FaceTime, Dr. Belzik can see the patient and look at a wound or talk to the patient. It's the closest thing I've seen.
That's
the
terrific.
FaceTime is encrypted, so it's
HIPAA compliant.
HIPAA
Oh,
compliant.
HIPAA.
Ah, okay. Well, the thing is, the family of 5 that they looked at on this particular program paid $100 a month for their combined care. And what the doctor would come is once a year, do their total physical, the whole family all at the same time. It was one house call. And then he had to come by one other time when the little boy fell down and cut open his chin, and he glued it shut and, saved them a trip to the emergency room. They figured when they added it up that they saved them about $2,000 in that year because they didn't have to take time off from work, from school, get babysitters, whatever, in order to be able to take these children and everyone to the doctor's appointments individually.
There you go.
Yeah.
Now, it's
So-
interesting that you use the term glued it together. Dr. Belzik, you use that in your practice. It's called surgical glue.
we do. Yep.
What does it do?
So it's basically an adhesive. So if you have a cut or a
Super glue.
laceration, right,
Super
that
glue.
you could bring the edges close together. You can glue it together.
Is it
Yeah,
a
but you don't want to do that
And,
with a deep puncture because you can seal the bacteria and bad
right.
stuff
So
in there.
in the case where you may have a deep puncture or potential source of infection, you seal, or even if there's active bleeding, it's not going to work, and you may cause other problems.
I was thinking of the young child who had a cut and didn't have to face stitches
Oh, yeah.
because those are terrifying to a kid. I know. I had them. Oh, somebody's phone.
That's okay.
That's okay.
Makes a nice sound.
And so anyway, doctor, with the iPad, you are essentially doing a concierge, and you could do the same thing. Maybe. I don't know. Your interaction with patients might be a little bit more intimate.
It's
It's not like looking at a sore.
I think it favors the practice of an internist. If you have a large internal medicine practice, then the concierge idea is a good one, because you can, this is the group that you're dealing with. But with infectious disease, it's mostly a consultative practice. So I get called by Dr. Belzik, or I get called by someone else or what have you, and we end up running to the hospital to see patients. We see patients in the office as well on a program basis. People will make appointments and we'll see them. But in general, most of the consults that I see are in the hospital.
Well, you're going to love this. Before we go on to the next story, we got a robot. Remember that?
Yes.
And if you ever seen the Segway, that scooter, it looks like that, but the wheels are only this big around, and it's got a pipe, and then it has an iPad, And doctor, you sat in your office and wheeled that robot into treatment rooms, and you talked to patients. They could see you, you could see them. How did people react to that?
So the Telerobot,
Telerobot.
right?
Yeah.
Was a novel concept. So some patients were very surprised, but then they realized it was me. And they,
It's
really
funny,
was
Bonnie,
you.
because you roll it in and then you could raise or lower it. For example, if you're in a hospital setting and somebody's in a bed, comes right down and looks you right in the face, scare the hell out of you. But your patients were open to it.
they were open to it.
Amazing.
Well, they're doing that butler situation in hotels too, certain
Yeah,
hotels.
that's true.
Yeah, and you don't have to tip them. They bring the tray. How are they going to take the tray out and serve you, though? I don't think they can do
I
that.
don't think it's going to pour a whiskey for you. I don't think so. We're going now through the season we call autumn. It's the fall. And the leaves are changing and the weather's cooler. And a lot of things happen, but for some people, the change of season has an effect on them.
Seasonal disorder? or
Well,
what
yeah,
do you call
and some people call it cabin fever. To me, cabin fever is you've been in the house too long, you need to get outside. But that's the traditional definition of cabin fever. But they're calling this cabin fever, and there's this new device called the LifeTrack Bright R450. It's a wristwatch sort of an affair, and it tracks light, blue light and white light. Blue light is very calming.
What do you mean it tracks it?
It wherever you are, the sensors can measure the amount of blue light versus other kinds of light that you're subjected to.
Okay. And so they tell you you're in a bad spot, move?
Something like that. Blue light enhances your moods, gives you more energy, and it actually helps you with your sleep. Now, this will alert you if you're getting too much or too little light. And there's a sleep tracking feature that I love this. You wear it on your wrist. It's got a vibrating alarm, so it knows when the ideal time for you to wake up is based on how deeply you're asleep and your sleep cycle. What do you think of that?
Amazing.
I could picture myself going, where's the button for 5 more minutes? Where is it?
Put me back in my dreams. Put
Where's
me
the
back in my
snooze
dreams.
button? You going to go, Doc?
I'm going to take my leave now.
Okay.
All right. Thank you very much. We'd love to have you
Thank
come back.
you.
Okay, it was a pleasure.
Thank you very much. Great information.
Okay.
Okay.
Thank you so much.
Doctor.
Okay. See you.
All right. Very good. As we move on. The Life Tracker is about $129, and it will start shipping in about a week. It can connect to your smartphone, and it can display on-screen notifications from incoming phone calls, missed calls, emails, texts, everything. Oh, there you go. So essentially, it's a watch phone, but it measures light. I like the part about it wakes you up when it thinks you should wake up. What if I disagree? Oh,
I
well.
guess you can shut it off.
Okay.
Okay. He loves to do
Okay.
that.
Do you want to talk about the stork, Doc? Wait till you hear this.
What's a stork?
Oh,
Maybe
boy.
Doc should talk about the stork.
Yeah.
Well, I don't know what the stork is about.
Well, the stork originally was a fictional bird that delivered babies. When your little kid says, "How did I get here?" The stork brought you, and you keep your fingers crossed that they don't mean.
I know why you gave me this story, Jeff.
Why?
Because you're embarrassed.
You want me to do the story?
No,
I'll
no,
do
no,
it.
no, no.
Go for
It's
it.
about conception. Okay. Okay.
What
so,
a concept.
Okay, conceiving a child can be fun,
Yeah?
but when things aren't working so well, sex
gets-
can become a chore.
What? Whoever wrote that must have a very dull sex life. Come on.
Really? Yeah, that's right. Yeah, really.
Come
yeah.
on, give me a break.
Okay, so the Stork OTC can help. So it's a device that consists of a modified condom and a delivery system.
A condom.
That doesn't sound very exciting right there, but okay.
Well, it gets better.
A man
Wait till you hear
wears the
this. You
special
love this.
condom during sex, and then when he ejaculates, he removes the condom, and there's a tip that holds the semen that's separated from the rest of the condom. So then that tip snaps onto a delivery service that's inserted into the vagina and pushed towards the cervix. Wasn't he there before? Sorry.
Yeah, it was.
Okay. It was like he couldn't deliver it himself. All right, okay. Perhaps it makes it go deeper. All right. And once on site, the condom tip holding the semen is released, and the contents are free to search for an egg to fertilize. So I can see that. I mean, depending upon how things go.
Hey, Doc, if you think we're kidding, it's $80 available at CVS and other farms. It's
At
real.
CVS, really?
Yeah. So you imagine walking into the drugstore and saying, "Is the stork here?" Please. Okay. Do you want me to do the next one?
Yes.
I thought you'd think I would be embarrassed about this
you
one.
do this one.
Oh, that hurts.
Stick it up. No, well,
Oh, yeah. Dr. Belzik, you know what colon therapy is.
Yeah, well, let's hear about it.
Well, colon therapy is also known as a colonic, and it's a procedure that claims to wash out your large intestine via a tube that irrigates you with warm water. You hold the water, you release it, and it's supposed to make you feel better and give you a lot of energy. And they give you this whole sales pitch about how
I've
it's
done
gonna.
it. Have you done it?
Yeah.
Oh,
No, I haven't done it. I had it done.
oh well, okay. That's what I had too.
Okay. What was your
Mine
experience
was pretty
of it?
rough. Well, she was kind of old school, I think, and she took the bottom of a baseball bat and kind of massaged my stomach.
Oh!
And I was pretty sore.
Nurse Broomhilda.
But she made sure she got everything out of there.
Oh, well, so the question, Dr. Belzik, is does it work? And the studies dating back to 1920 say no. In addition to waste, your colon houses friendly bacteria. And these bacteria actually manufacture vitamins that you need. They're involved in defending you against dangerous pathogens. And so when you empty all of that, you lose all of that. One study said that cleaning the colon immediately altered the types of bacteria in a patient's stomach. Another found that cleaning out the colon knocked down the bacterial population and made it easier for potential dangers. And there's always the danger of a perforation, a tear.
Oh, yeah,
That's
with a
where
baseball
you get
bat.
with the baseball bat. Oh my God, it's a Louisville Slugger. Oh,
I have one of those.
a Slugger? But you don't use it for that.
Well, I don't know. I have something the Dodgers gave me with my name on it.
Well, oh, there you go. The Journal of Family Practice, their journal, says complications from colon cleansing. Oh, you're going to love this. Cramping, abdominal pain, vomiting, rectal perforation, blood poisoning, kidney failure, fatal amoebic infection, and fatal accumulation of gas in the veins.
Just say no. Just say no.
Doc, can the veins absorb gas? I haven't heard that one.
Well, pulmonary emboli is a similar phenomenon where gas
Pulmonary
bubbles
embolism, yeah,
can
that's
travel.
right.
So,
That kills a lot of people.
yes, they do.
Embolism. Okay, this one's for you, Doc.
All right. So, iOS 8.
Yeah, just by way of explanation, iOS is the operating system for the iPhone, the iPad, and the iPod.
What about Android? Is that
No, this is strictly for
okay,
this.
All right. So they're starting to explore apps for medical specialties. The iOS 8 has an Explorer function within the App Store and lets physicians search for their apps based on their specialty.
Right. Now, you're an iPod, iPad, iPhone kind of guy.
Yeah, he's
Yeah,
looking at that
yeah,
instead of the page I gave
Yeah,
him. so
and
I'm
here's
taking
his
it
new
back.
iPhone 6. Right?
Yes.
And so if you go searching for apps, you can search by your specialty, which kind of limits it because there's so much to search for. There's so much information on the net. Do you think that's a good idea?
I think it's a great idea. You may have to know how to search it.
Well, yeah, the
So,
problem, Bonnie and Dr. B, is the indexing. So you might go under cardiac before you can find certain things that you wouldn't expect to find under cardiac. So I'm wondering if they have a specialty for podiatric.
I don't know, have to look it up.
But it would seem to me it would make it easier for you to find the kind of apps you're interested in.
Right.
Okay, why don't you check it out?
I
Let
think
us
they
know
even
next
have
week.
right.
Okay. We're moving right on. We're doing well on time. Boy, the show went by so quick. Don't
We're
forget,
almost there. Oh my gosh.
yeah, we are also doing a show called Turn On to Tech, and Dr. Belzik, you've been a guest on that show. So we're going to do that show next. But this show, the medicine show, is my love. It's just what I like to do.
We forgot to bring in that thing from the.
Oh, you want to go get it?
I'll get it.
We have a surprise for you, Dr. Belzik.
Uh-oh.
A couple of apps you might want to know about. YouHear is a 6-minute test for potential hearing loss. YouHear. And it's just like it sounds. There's a vision. We do a special on apps one of these days. Doctor, in honor of your service, we present you with the Squatty Potty.
Squatty Potty. Now, Howard Stern swears by this.
But then he's a different kind of a person. Doc, you put this around your...
You put it,
You want me to try it on?
You get, no.
No.
Put it in front of your chair, chair in the bathroom.
You put it in front of your chair.
Your toilet.
Right.
And you stick your feet up on it, and it makes things
It's supposed to make the flow better when you're on the pot. How do we say that politely? It's fecally fantastic.
Yes.
And it's for real, Doc. It's not a joke.
It's a real Squatty Potty.
Would you like to take it home and try it?
I think I've already tried that maneuver without this thing, but yeah. I mean,
Oh, boy, you're toughing it out. You got to love it, Bonnie.
If you don't
gotta
want to take
love
it home, Tyler's going to get to it.
Okay.
We're
you know
going to get
what?
somebody to do this.
Yeah, try it out if you want to, but they're very serious.
do I have to return it to you?
No. Not if you like.
Not unless you want to gift wrap it. No, you don't. Bonnie, did you try it?
I did.
And what were your findings?
I found it interesting, but I tried it once, and my father uses the same bathroom, and I couldn't keep it in there because he couldn't move it, and he couldn't get up and down
Right.
the toilet, being 91 with that
Yeah.
hair. So that was the one time I tried.
I guess the real question is, by picking your feet up, it's supposed to make a
puts
straight
you in a more
path
natural
for elimination.
path. I mean, we didn't
You
originally
thought we were
have
joking with you,
toilets.
Doc. We
really
weren't.
did squat in the woods.
That's right, a squatter. I wonder if that's where the word squatter came from, where people own land if they squat on it long enough. Boy, wouldn't want to walk around on that
It's
land.
your territory. You did it long
Oh,
enough there.
boy. Earlier in the show, we talked about flying and airplanes, and so you have some precautions to use while flying.
we have time?
And Dr.
Okay.
Belzik, you might want to know about this because you fly.
All right, let's
Okay.
hear about them.
Well, the blankets and pillows aren't fresh, except for on the originating flight at the beginning of the day. So they're just put back in the bins. And
Really?
Yeah.
That's not sterile.
And so it's got to be cold in there. So come in prepared. Bring extra things. Bring a pillowcase if you want to use their pillow. Just be smart about it. Tray tables and armrests are cleaned about once a day, usually when the aircraft remains overnight.
Bring wipes.
So bring some wipes, you bet. Bring some disinfectant wipes. Okay, life jackets can be missing from under your seat because people steal them as souvenirs.
Jeez.
So be sure to check under your seat to make sure your life jacket is going to be there if you're going to be flying over water. All right, and you shouldn't touch plain water ever, and
What?
don't drink it.
Really?
Well, drink the water that comes from a bottle. Bring hand sanitizers. Don't touch the water. The ports to purge the lavatories and refill the aircraft with drinkable water are within a few feet of each other, and sometimes the same guy services them.
Well, it
And-
gets worse.
Yes, and what Wall Street Journal ran a test of tap water from 14 flights in 2002 that found bacteria levels tens of hundreds of times above U.S. government limits.
Wow, they get away with it. Dr. Belzik, you have a website.
I do. So you can log on to www. Sherman Oaks Hospital, and it's .com/APC.
APC, Amputation Prevention Center. I don't know where the time goes.
Okay, one more thing. If you're going to go traveling during the holidays, get your passport now. Now it's not busy. It will be crazy later.
Oh, good advice. Anyway, you can send us emails with your questions at uponmedicine@yahoo.com. And you can call us at area code 844-399-5333. We'll see you back next time. Stay tuned for the Tech Show. This has been Up on Medicine with Jeff Levy, Bonnie Jane Bentley, and Dr. Ronald Belzik. Thanks for joining us.
You're listening to Turn On
show.
to Tech with Jeff Levy
I better close the
and
mic.
Bonnie
Bye,
Jane
everybody.
Bentley, right here on LA Talk Radio.